All right. It looks like our Facebook live stream is up now. So welcome everybody to this briefing from Health Officer Dr. Jeff Duchin. Dr. Duchin, the floor is yours.
Thank you, Gabriel, and thank you everyone for joining us today. I'll start with a review of the epidemiology, discuss our vaccine distribution, and a little bit about the J&J pause, and then we'll have time for discussion. As of yesterday, there have been 92,599 confirmed cases of COVID-19 in King County. There have been an additional 5,503 hospitalizations and 1,474 deaths. This week's forecast is that the rough weather system has stalled in our area. Over the past week, 294 new cases were reported daily. And that's a relatively stable number over the past 2 weeks and double the level we saw in early March. Our 14-day incidence rate is 198.5 per 100,000, which is similar to last week and about double what it was at the end of our fall and winter surge in early March. Our incidence rates have been trending up for all age groups except for 65 and older and under 5 years, with the highest rates in 18 to 34-year-olds, followed by 35 to 49-year-olds, and then the 5 to 17-year-old age group. And these age group trends are similar to what we've observed throughout most of the pandemic after the initial wave in long-term care facilities, with the important exception of the recent sustained decline in cases among older adults. The fastest growing increase recently is in the 18 to 24-year-old range. And overall, COVID-19 incidence remains highest in the cities of South and Southeast King County, including Covington, Enumclaw, Auburn, Kent, Federal Way, Burien, Renton, SeaTac, and Tukwila. And over the past 14 days, these areas are experiencing double to triple the number of cases, hospitalizations, and deaths compared with Central and North Seattle, Shoreline, the East Side, and Vashon Island. Hospitalizations have also been rising since early March. Last week, 97 King County residents were hospitalized with COVID-19, which is up 15% from the week prior, with one person hospitalized every 1 hour and 45 minutes in King County currently. Our hospitalization rate is hovering around 3.5 to 4 per 100,000 per week, which is double what it was in early March. Both the current rate and total number of hospitalized people last week are about 40% of the number that were hospitalized during the peak of the fall and winter surge. The greatest number of recent hospitalizations are in the 40 to 69-year-old age range, followed by 20 to 39-year-olds. And over the last week, more 20 to 29-year-olds than people over 70 were hospitalized with COVID-19 in King County. The increasing number of hospitalizations among young adults reinforces that although the rate of hospitalization is low overall in this group, when COVID-19 is widespread, severe cases will occur in persons of all ages. Weekly deaths, however, have fallen dramatically since the peak of the fall and winter surge. On average, over the past 2 weeks, 1 to 2 King County residents have died of COVID-19 each day, compared with 9 deaths per day during the winter peak. With protection of older adults through vaccination, the proportion of deaths in younger age groups is increasing. Over the past 14 days, 9% of deaths are in the 25 to 49-year-old age group, compared with 2% overall during the outbreak. And 27% of deaths are in the 50 to 64-year-old age groups over the last 14 days, compared with 13% during the outbreak as a whole. The proportion of deaths in adults 65 and older has fallen from 65% overall to 27% in the last 2 weeks. So although most of our older adults are protected through vaccination, not everyone is vaccinated. And when transmission increases in the community, the virus can still find its way to those who are most vulnerable and remain unprotected. And although less frequent, COVID-19 does cause serious illness and hospitalization, as well as deaths in younger adults. A few words about the variants of concern. Recently, Washington State is sequencing about 8% of positive test samples. Most COVID-19 cases in Washington State and in the US are now due to variants. A worrisome sign is the proportion of B117 variants doubling approximately every 2 weeks in our statewide numbers, compared to a relatively stable proportion of the B1429, which is the California variant. We have nearly 1,000 variant cases that have been identified in King County. We know this is just a small sample of the total number of variants that are circulating, and a small sample of our COVID-19 cases have been tested. We've recognized also 21 cases of the P1 variant that's been found in multiple states, as well as British Columbia, the so-called Brazil variant. And these are all more infectious viruses that represent a significant and increasing threat to our ability to bring this outbreak under control. We need to up our ante on COVID prevention to stay in the game. Now the phases. Last week, based on metrics outlined in the Roadmap to Recovery Plan, King County remained in phase 3 of reopening. The state will next evaluate our metrics and phase placement on May the 3rd. Our current numbers have us hovering just below the metrics that could roll us back to phase 2 of reopening, as outlined in the state's Roadmap to Recovery Plan. So we've had now almost 2 months without significant progress in decreasing the level of COVID-19. After a recent rise, cases and hospitalizations are substantial but holding steady, and we remain at risk for a worsening outbreak over the coming weeks. Recent increases in cases and hospitalizations are likely due to the combination of opening up more activities and the impact of more infectious variant strains. The threat from COVID-19 will continue to decrease as more people are protected through vaccination. But until more of us are vaccinated, we all need to do all we can to prevent serious illnesses and hospitalizations from COVID-19 in all age groups. To protect yourself and those around you, wear a well-made, snug-fitting face mask, limit activities with unvaccinated people from outside your home, avoid crowded indoor spaces, and pay attention to improving ventilation in workplaces, businesses, and homes, including by opening in doors and windows. If you're out, you're doing some shopping, an errand, going about your business, and you go into a place of business and the doors and windows are not open and it's a smaller place, it's crowded, it's poorly ventilated, you should ask why not. Remember, COVID-19 spreads primarily through the air and often from people who don't appear to be ill or before they develop symptoms. Let me talk a little bit about vaccine. As of yesterday, over 51% of King County residents age 16 and older have had 1 or more doses. That's almost 1 million people. And 32% are fully vaccinated. And this is fantastic. Among our older adults, 90% of residents 65 and older have received at least 1 dose, and that's compared to 80% across the US. And 76% have completed their series, compared with 64% across the US. By race and ethnicity, for adults 65 and older across all racial and ethnic groups, we've passed the 75% or higher vaccination coverage rate for 1 or more doses. And when we look at the younger groups now, which is where our challenge lies ahead, for people 16 and older, we see our disparities more prominently in the vaccine rates that we will continue and work to address. For example, among white, Asian, Native Hawaiian, Pacific Islander, and Native American residents, our single vaccination rates are in the 49 to 56% range. Among Black and Hispanic residents, however, the single-dose vaccination rates are in the 35 to 37% range. And we expect these numbers to improve as we start to vaccinate more people in the younger age ranges as of Wednesday. Now, Hispanic and Black residents have experienced higher rates of COVID-19 and higher hospitalization rates compared to white residents. And for this reason, we continue to focus our vaccination strategy on closing the racial equity gaps. And while there's a lot more work to be done, we are making progress. The proportion of total vaccine doses administered to communities of color has been increasing week by week. We continue to work with community members on ensuring vaccine sites are appropriate and lowering barriers to access. We want to make sure patients get answers to questions they have about vaccination and vaccination safety, and try and make these community vaccination sites as attractive, as easy to access, and as frequent as possible. So we're continuing to hold multiple of these community events in collaboration with many community organizations. Last week's events served about 1,000 people, focused on Khmer, Lao, Vietnamese, our Black, African American, and Pacific Islander communities. And I know many of you are aware of the pause. I think probably all of you are aware of the pause in the administration of the Johnson & Johnson vaccine following the guidance of the FDA and the CDC. And this pause is happening while the Advisory Committee on Immunization Practices reviews the vaccine safety information in detail. Our vaccine safety monitoring system was able to pick up a very rare, although serious side of adverse event that's associated with the Johnson & Johnson vaccine. And the committee is now fine-tuning the estimate of how rare that is, whether there are certain groups in which the risk might be raised relative to others, and to create the best guidance going forward to ensure the utmost vaccine safety. The important thing, I think, to understand is that the benefit of this vaccine will and does greatly exceed the risks for almost all groups, and it's quite likely that this vaccine will be back in use, and I hope it will be very soon, where it will continue to save lives. It's important locally to understand that we did not have a lot of J&J vaccine. There was a manufacturing issue that limited the supply. It was a relatively new vaccine, hadn't ramped up to full-scale production yet, so that pause has not impacted our efforts to vaccinate people who are living homeless. Our mobile vaccination teams have been visiting permanent supportive housing sites and homeless shelters to provide vaccinations to people. And we have an adequate supply of Moderna vaccine so that we did not have to cancel any of the scheduled visits for the homeless service sites. And we've vaccinated nearly 1,000 people at this point who've been living homeless through these mobile efforts. Now, with respect to vaccine supply, we anticipate approximately 76,000 first doses available in King County this week, and that is about 2/3 to 3/4 of what we've received in the recent past weeks. And it is about 2/3 to 3/4 what we estimated we needed before eligibility opened up this week, which invited another 650,000 King County residents to seek vaccine as of yesterday, in addition to the 250,000 or so who were previously eligible and still unvaccinated. So we believe there are approximately 900,000 people in King County who are eligible for vaccine today, and we want to do whatever we can to get vaccination to you as quickly as possible when those supplies are available to us. Unfortunately, the Department of Health tells us the vaccine supply will remain flat for the next 3 weeks. And as a result, it will be difficult for everyone who wants to be vaccinated today to be vaccinated as quickly as possible. However, I want to make sure that everyone understands that we are doing everything we can possibly do to get vaccination to you as quickly as those doses are available to us. So with that, I would like to pause and welcome your questions.
Thanks so much, Dr. Duchin. If members of the media have questions, please use the raise your hand function in Zoom and we will call on you in turn. It looks like we've got a lot of questions today and not a ton of time, so I would ask folks to just keep your questions brief and please just ask one question per outlet. We can circle back if folks have follow-ups if there's time. So we will begin with Keith Eldridge. Keith, please go ahead.
Thank you. Checking on your metrics, they're high. And is there the chance that King County is going to slip into phase 2 territory before next May the 3rd, and might you voluntarily ask for things to be rolled back? And is there a chance you may have to roll back on your own or be forced back on May 3rd?
Thanks for your question. There's always a chance. The metrics, the cutoffs, they're not magic numbers. They're not magic thresholds beyond which something, drastically different happens. They're measures, goalposts, or guardrails that we set up that help us understand, when we may need to do something differently. But there's not anything, drastically different that happens on one side or the other of that line that we are hovering around. I think the key thing is not whether we go over it for a day or two and then come down, but what the trend is at that point. So initially, a couple of weeks ago, I would have thought we would have passed that threshold and been headed way up because that's the way we were pointed. However, we've been vaccinating a lot of people. Perhaps people are taking more precautions, and the weather's better. Ventilation, people are opening their doors and windows, safer environments. For whatever reasons, the number of new cases and hospitalizations has relatively stabilized. Now, I would like to see those numbers driven down as much as possible to put us in a much safer position, because as we're vaccinating more people, at the same time, these more contagious variants are spreading, and they make it much easier for the virus to spread in the community. So we will need to, unfortunately, continue to take these COVID-19 prevention steps very seriously for the next month or two, at least, as we get more and more people vaccinated, to put us in a relatively good position with respect to minimizing the number of illnesses and hospitalizations that we're seeing occur in our young and middle-aged adults. So the bottom line is, though, however, I can't predict where we're going to go. I can only encourage people to do everything they can to put us in the right direction, bend that curve down, suppress the virus, and at the same time, we will be vaccinating as quickly as humanly possible with whatever doses we get. All of this should help us counteract the influence of the new variants and decrease the likelihood that we will cross a threshold requiring us to step back to more restrictive activities. We do have the ability to do that in the county. All local health officers and local health jurisdictions can bring their counties back anytime they feel like it's necessary to do so for public safety.
Thanks so much, Dr. Duchin. Our next question is from Kate O'Connell. Kate, please go ahead.
Thanks so much for your time, Dr. Duchin. I wanted to ask you about the Vax Day event this week, obviously a big milestone for the county and the state. You have mentioned, and so have others, that people need to pack their patience with this. And with the supply of vaccine looking like it's gone down and going to remain flat for the next few weeks, what do you think, basically, how is that going to go with people getting appointments? Is it going to be tough? Are we looking at particularly more issues for folks who have found it harder to begin with? Kind of what's that landscape going to look like for folks?
Well, pack your patience is a term I can't say I understand, but I do think people need to have patience, unfortunately. And I think folks have had a lot of patience. They've had no choice. And although we'd wish we could bring vaccine to everyone right now who wants it, we are not in control of the vaccine supply. And we are moving those doses out as quickly as possible when we receive them into communities so that people can be vaccinated, and we will continue to do that. However, we know that the supply is limited. We had believed that the supply would be increasing at the time that eligibility was increasing. In fact, the supply has decreased. As I said, this week, Vax Day week, we have fewer doses than we had 2 weeks ago. And we expect that next week we'll have fewer doses than we had 2 weeks ago. So the good news is we are getting more people vaccinated over time, and this temporary decrease in doses will be time limited. And we expect by late April, significant increases in doses again. But it will take time for everyone who is interested in getting vaccinated to get an appointment. We are making that happen as quickly as possible, but it really depends on that supply of vaccine that we unfortunately can't control. So we're working very collaboratively with our colleagues at Washington State Department of Health to ensure that, whatever doses are available, we can take advantage of. And we will continue to do that. And we're advocating for more doses at every opportunity. And despite that, we know that there are more eligible people than we have doses for. And so I apologize to people for the frustration they're feeling. I understand it, and I wish it wasn't something that we all had to go through, but we are doing everything we can to minimize the wait and to get these doses out into the community as quickly as we can once we get them.
Thanks so much. Our next question comes from Jeff Pahola. Jeff, please go ahead.
Yes, thank you for taking the time. I guess my question is, we know the biggest impediment right now is the lack of vaccine, and obviously production of that needs to ramp up and distribution as well. But when that that problem is solved, whenever it is, are you still concerned with the small but still significant number of people who are resistant to getting the vaccine? In fact, I had a conversation with someone a while back who referred to it as a DNA manipulator. People have all sorts of misinformation about vaccines, and this one in particular. Are you concerned about that in the long run?
Yes, it's a very important issue. People do have a lot of concerns about vaccines in general and about this particular vaccine. And although we've been very gratified by the overwhelming number of people who want to be vaccinated to protect themselves, their families, their loved ones, their community, their coworkers, there are some people who are at this time not interested. And there are different reasons why different people may not be interested in vaccination today. And we are working to engage, understand why people might be hesitant, to provide good information, resources, do what we can to help people make that choice that will both reduce their own risk for a serious adverse health outcome, but also reduce the risk to their family and others around them in the community. So vaccine, so-called vaccine hesitancy is a very important issue. We are aware of it, and we are very much engaged in trying to provide good information and support to people to make good decisions about their health.
Thanks a lot, Dr. Duchin. Our next question comes from Patrick Quinn. Patrick, please go ahead.
Hey, Dr. Duchin. Quick question about tonight, T-Mobile Park and Lumen Field for the first time. At the same time, we'll have fans back in the stands, and both obviously are at limited capacity. But I'm curious, is this concerning two major, and obviously they're outdoor, but major sporting events happening at the same time, given the current case count and hospitalization rate? And for those fans going, any tips, I guess, just to protect yourself when you're going to these large events?
Yeah, thanks for the question. The fact that they're happening at the same time per se is not as much of a concern to me. I think, outdoor activities are, much safer than indoor activities. And the things, being outdoors in a stadium where you're, open air and not in close contact with someone from outside your household is a low risk activity. The things I worry about and the things people should be careful about are traveling to and from not only a sporting event, but any activity with others who might not be vaccinated, closed transport through a car, vehicle, anything where you would have close contact with others in a poorly ventilated space. Eating is a particularly high-risk activity because masks come off during eating. This virus is exhaled in the breath. It's exhaled when people talk and sing, and with loud speaking and cheering. And this is something that might be relevant at a sporting event. If you're doing a lot of loud vocalizing, rooting for your team or against the opponent, you're putting a lot more virus out into the air. Now, again, when you are in an open air environment, that's not a high level of risk, but to someone who would be right next to you, if that's not someone that you live with in your family, or if you or that person is not vaccinated, the risk would not be zero. There would be a risk of inhaling that virus should one of the two be infected. So again, the key things for people to understand is that, if you're at a game, there is still a risk for transmission. If it's outdoors, open air, the risk is lower, but avoiding close contact with people, keeping that physical distance of 6 feet or more whenever possible, mask wearing whenever in public spaces, and in particular, don't let your guard down around, snack time when you're eating. Just think about the environment, the risk environment. It should be well ventilated. Again, the distancing is important, and then masks on as soon as possible. This virus spreads through the air. It spreads particularly well with close contact, indoor air spaces, poorly ventilated spaces where doors and windows might be closed, or where there's crowds. And so those are I think the key things that people should look for.
Thanks so much. Next question comes from Glen Farley.
Hi. So a quick question on dose allocations. How many, the Department of Health made some forecasts a month ago saying we would be in a much better position in terms of the number of doses coming by now. How many doses were you expecting for this week about, and how many doses did you actually end up with? What's the gap?
Mm-hmm. Yeah, so for the 2 weeks previous to this week, we had approximately 100,000 doses, first doses coming to the county. That we thought was adequate to meet the needs of the currently eligible before the eligibility opened up to everyone, if that could be sustained for a 3-week period. However, for week 3 of that 3-week period, or week 2 or 3, I'm not sure, but before that eligibility opened up, our doses decreased to about 2/3 to 3/4 of what it had been. So I don't remember what the forecast was at the time. You'd have to go back to the Department of Health, I think, to get their forecast and what they actually received. But we have been getting approximately, in recent weeks, less 2/3 to 3/4 of what we think we need to meet the demand before eligibility opened up. And, I can't tell you what we're going to receive next week, but the current forecast is similar to this week, which would mean that there's going to be a significant disconnect between the supply and demand, because we already have fewer doses than we think we need before eligibility opened to everyone. So the distance between the number of people who are seeking doses and the number of doses that we're actually getting has increased in recent weeks, where we were hoping and informed that it would decrease. We can probably get back to you with the precise forecast numbers and what we ended up with. I don't have them off the top of my head, but I can tell you that 2 weeks ago, the numbers were either at forecast or above forecast. And this week, it was significantly below forecast, and next week is significantly below forecast.
Thanks so much. We have time for just one more question. Jessamine McIntyre, please go ahead.
Thank you so much, Dr. Duchin and Gabriel. When it comes to the variants, we're obviously seeing B117 as the leader in the locker room, and now we've got 1429 following up. That's the California one. Is there concern about another variant that might be lurking, because they seem to be popping up in different areas of the United States and the world, that could all of a sudden become a leader here and overtake before we get the chance to vaccinate more?
Yeah, the issue, you're asking an important question about variants and where they come from and how they evolve and so on. New variants are appearing constantly throughout the world. As this virus transmits from person to person, it it is given opportunities to mutate. Every transmission opportunity is a mutation or variant opportunity. It's one of the reasons why we really need to control, the level of virus in our community, but also in every community across the world, because variants will develop anywhere disease transmission is happening at a significant level. So sure, new variants can develop over time anywhere, and they can develop characteristics that might make them more transmissible, harder to detect with laboratory tests, harder to treat with antibodies, or less susceptible to protection from vaccination. That can always happen. However, I don't see anything on the short-term horizon that would be likely to displace B117, I think, which is the leading variant across the country now, that's moving quickly and that has significant concern about increased severity of illness. That's not to say it won't happen. It's possible, and that's why, because our vaccines provide, at least as far as we can tell currently, good broad spectrum coverage against the current variants to get as many people vaccinated as possible, decrease transmission, and also protect people from severe illness. Over time, if the virus changes substantially, we may need booster doses with vaccines that are tweaked slightly to target better new variants that developed. And this mRNA technology in particular is very easy to adapt to changes in the virus. And I anticipate over time, if people need booster doses, the new versions of the vaccine will more effectively prevent illness with whatever variants are evolving. But I don't see anything, at least on the short-term horizon, except for the ones that we've already recognized, the 117, 1429, P1, that would be, the major sources of concern for our area.
Thanks so much. That's going to conclude our Q&A. Dr. Duchin, do you have any closing thoughts today?
Thanks, Gabriel, and thanks again, everyone, for taking time. We are in a standoff with this virus currently, and this is not the time to blink. The growing number of people being vaccinated is undoubtedly limiting damage from these new variants and from our increasing activities. And the relatively low number of deaths currently is a tribute to the effectiveness of vaccination in our high-risk adults. Increasing vaccination coverage ultimately is our best weapon against COVID-19, but at the moment we can't rely on vaccine alone to fully counteract the threat of a variant-driven surge in the next month. Depending solely on vaccine right now is like fighting with one hand tied behind our back when we need a double-fisted strategy. So let's continue to do all we can to work together to knock this virus out once and for all. I thank you again for joining us and for getting good information to the public to help us control this outbreak as quickly as possible. And I look forward to speaking with you next week. Actually, on that topic, next week, I just learned that there's an ACIP meeting that was scheduled for next Friday, so it may not be possible for me to join you. As some of you know, I participate in the ACIP COVID-19 vaccine work group. And so I would be unavailable during the time of that meeting. So if we need to change our time next week, you'll know why. Thanks again for joining us, and I hope everyone has a wonderful weekend.